Hi, everyone. We will give people a couple more minutes to join the webinar. Okay, so I think we can get started now. This is our 13th webinar for the post-active treatment surveillance in prostate cancer special study. So here's the list of the study progress as of today. So we have 4,754 patients have been submitted. So thank you for everyone for their hard work. And then we have 510 sites who are complete with the study, and 439 are still working, and 188 sites have not started. So we really encourage those sites to start if they have not started. So if all of your cases are submitted and the site has completed the study, we will not be sending out emails to confirm if your site has finished the study. So if all of your patients are showing up at the bottom of the screen, then your site is complete. So once the study is complete, webinar participation is not necessary unless you still need NCRA credit. So we just want to remind everyone the purpose of the study is for patients who have received curative intent prostate cancer treatment to determine whether more frequent PSA testing leads to better survival or more harm for the patient. So in order to answer this question, it's important to know every PSA test that the patient had. We want to know exactly how frequently a patient is having PSA tests and to know if the patient has had a recurrence. So our goal is to have each site complete 12 patients for the special study, and monitoring has shown a higher expected rate of ineligible patients. So the sample size seems to be much lower than initially projected. Only patients who are treated with either radical prostatectomy or radiation for prostate cancer are included in the study. So we've have made people aware on most of the webinars now that we've made study modifications which are necessary to reach the projected sample size. So we have extended the 5 years of eligibility. We have cut that down to 3 years for the patient level eligibility criteria question. And we've also replaced the replacement queue with patients from 2008 to 2010. And these changes went into effect May 30th, and so there won't be any more changes made. We have also updated instructions version 2, and that is on the website and the web form, and we will not be mailing that out. So the deadline for the study is August 28th, and that's a Monday. So sites that completed the study prior to May 30th will not be affected by the changes. And then the 2008 to 2010 patients only affect the replacement queue when a patient is submitted as ineligible. Previously submitted cases will still count towards the 12 total. Additional cases have already been added if the site had less than 12 patients, but sites are not required to submit more than 12 patients. So we thank everyone for asking questions. Most questions relate to, is the patient eligible? So PCPs may have checked PSAs, biopsies, and scans. So it's important to enter all of this information if the PCP checked these items because they are relevant to the study. We recommend waiting 2 weeks once the template letter is sent and the office is called to hear back from outside facilities before marking the patient ineligible. We don't want sites to waste time waiting for the records to come back, so we suggest waiting 2 weeks, and if you haven't heard, then mark the patient ineligible and move on. So when it comes to the eligibility questions, the key question is, do you feel you are able to record all the PSAs a patient has had after treatment? 3 years is required for a patient to be eligible, and once eligible, we ask that you enter all of the available data and stop at 8 years. So for the eligibility criteria, there's 3 questions on the determination of eligibility screen. So you need to have evidence that medical records are available for the patient for 3 consecutive years or until distant recurrence or death, whichever is first. And that's also, so it's distant recurrence, death, or until the 8 years is up is the surveillance period. So, and then for patients who have had surgery, you will need the urologist, PCP, and then for patients that have had radiotherapy, the radiation oncologist and urologist and primary care physician can be identified. So, and then the third criteria is the patient needs to have at least 1 PSA test result within 2 years from the surveillance start date. So if any of the eligibility questions are answered no and is submitted, a new patient should automatically be added to the list once the page is refreshed. If the patient does not have a PCP, then the patient is eligible. So if you don't know if the patient has a PCP or if the patient has a PCP but you're not able to get the records, then the patient is not eligible. A complete record for 3 years is needed for patients to be eligible. So if it's not possible that some patients do not have PSAs every year. So if you have all of the records for the first 3 years and they didn't have PSAs every year, then they can still be eligible. Patients receiving care at the VA are not eligible. So one of the common questions we've been getting is if you have 3 years of information, but the patient moved out of state after 6 years, is the patient eligible? Or if you only have 3 years, but you don't have the full 8 years, is the patient eligible, or something similar to this? The patient is eligible with 3 years of record. So 8 years is the stopping point, not the eligibility criteria. So for this example, please enter all of the data that is available. So if you have all the data up until 6 years, then we would ask that you enter all of the 6 years. So we want all of the PSA information until the time of distant recurrence or death, or until the end of the surveillance period, not at the biochemical recurrence. So please round the results to the nearest 10. So the way PSA should be entered is you would move the decimal over and then round. So if a PSA is 1.2, you can enter the 0, 1, 2, or 12. So numerically, those are identical, and both answers will be accepted for the special study. So when the patient has a result of less than some number, then we ask that you please enter the result of 0 for the study. And then this is the only instance where we differ from the Ford's manual. And so we ask that the rest of all the PSA information should be the same that you normally enter for the registry. So the urologist, radiation oncologist, and PCP and PIs can all be on the same line on the surveillance tab. You don't have to have one line per provider. When the doctor indicates possible recurrence and treatment starts, this should be considered a recurrence. So the date of recurrence should be the date of the doctor's note, and the term salvage radiotherapy indicates a recurrence. So after definitive radiation treatment, if cancer is shown in the TUR pathology, we ask that you please record this as a local recurrence. So we've said this on a couple webinars that there are some slight differences between the special study instructions and the Ford's manual. So if you're noticing the differences, please just enter the special study, use the special study instructions for the special study only, and use Ford's for the routine data collection for the NCDB. So for biochemical recurrence and never disease-free instructions, those are different from the Ford's manuals. And then you shouldn't update the NCDB with the recurrence differences. If you find that a patient has a recurrence by Ford's definitions and the recurrence was not previously recorded, then please update the patient's NCDB record with that information. So if error messages appear when using the data links credentials when logging into the web form, please use a lowercase if there is a capital in the password. Once the case is submitted as ineligible, it will automatically be replaced and will not appear on the patient list. The web form will not allow submission of incomplete information, so make sure when you're trying to enter a patient that all of the information is there and there are no blank answers. So if changes need to be made to a submitted patient, you should email the specialstudy@fax.org email address and include special study IDs and SPINs in the communication. So if people are having errors when trying to submit patients, and if there's any problems with saving, please close the browser and try again. The web form will time out after 3 hours. So if you're not saving periodically, then the information that you have entered could be lost and you might need to enter it again. There is no technical issues. It should just be that you save after entering all of your information. So here is the slide for study communication. We can be reached at specialstudy@fax.org if you need a specific email, or we just post all of our information on the special study website and the Cancer Forum Standards Resource Library. And if you're emailing us about a specific patient, then please include the special study ID and also your SPIN, which is your COC identifier. So emails for the special study are being sent from the specialstudy@fax.org email address through an outside server. And if you haven't been receiving these emails, send the information to your IT department and ask them to put us on the whitelist. And here's the NCRA National Program Recognition information. So this is webinar 13. So it's NCRA number 2017-082. And today's webinar and the rest of the webinars throughout the study will only be 0.5 CEs. And they will only be 30 minutes long, but they will still start at 11 o'clock every Tuesday. So the updated instructions document version 2 is available on the study website and the Cancer Forum. So questions from previous webinars and the Cancer Forum will be included on all the webinars. If a site is complete with the study, attending the webinars is no longer necessary unless they need NCRA credit. So now we'll be reviewing some previously asked questions. So what PSA level should be used to classify a patient as having a recurrence? We are not asking registrars to interpret the PSA results. So please record recurrence if the clinical notes indicate a recurrence or if the patient receives treatment for recurrence. And if the patient has a recurrence that was never disease-free, we are only calling never disease-free a recurrence for the special study only. And we ask that you please record the date of the first PSA test after primary treatment as the date of recurrence, and that should only be in the section for date of recurrence detection by any method. It should not be considered a local recurrence unless it meets the definition in the instructions manual. So the doctor's note may also say persistent disease after treatment, and that is also considered never disease-free. So are sites automatically compliant with the standard for submitting cases to the study? Sites that submit all of the patients by the study deadline of August 28th are compliant with the standard 5.7 in 2017. If you have any patients that are still showing up at the top of the screen for patients to be submitted, then you will be considered not compliant. All of your patients should be showing up at the bottom of your screen as the submitted patient. So sites that have less than 12 patients on their list to start will still receive credit for standard 5.7, and sites are required to submit all of their eligible patients up to 12 total. So if you have a lot of ineligible patients, that does not count into your 12 patients. You have to submit 12 eligible patients, or if you have less than 12, then submit as many as you can. So standard 5.7 requires that all data needs to, or 5.1 requires all data needs to be abstracted by a CTR. So if the urologist and the PCP are retired, we ask that you please collect the records from their offices, and all NPIs are required for each provider that saw the patient during the surveillance period. These will not automatically populate like the NCDB tab, and if the NPI on the surveillance tab is unknown, then we ask that you enter zeros for if there's no provider, or nines if they have the provider, but the NPI is unknown, and then sevens if it's unknown whether they have this provider. So if the urology office has 3 consecutive years of PSAs done and the PCP office does not respond, is the patient eligible? So in this case, no, the patient is not eligible because you need the PCP records. The PCP might have checked additional PSAs, and the only way to know this is to get the PCP records. The only exception is if the PCP office is able to confirm that no PSA was checked by the PCP at all during the surveillance period, during the 3 years to make the patient eligible, and then the study needs to know the total number of PSAs checked for the patient. Any incomplete information about the total number of PSAs checked will make the data analysis wrong. And one of the primary goals of the study is to see if patients with more PSAs live longer. So knowing all of the PSAs from the different doctors is very important. And now we can go back to the communication slide. And we can start answering questions from today's webinar. So if cases are not completed by the study deadline, then unfortunately standard 5.7 will have a deficiency at your site. So if you're getting an errors when trying to submit the patient, make sure everything is formatted correctly and that there should be a red box around the fields that are not answered. So everything needs to have an answer in it, and make sure that you're answering the questions at the bottom of the PSA and scan tab. Sometimes people overlook those questions, and just make sure everything is answered. And if you're still getting errors, you can email us and we can tell you where the error is, and then you should be able to submit the patient. So if you're unable to obtain records from either a retired doctor or other facilities who won't provide the records, and you just have all ineligible patients, you just need to assess each patient's eligibility individually, because maybe you might have a patient that comes from a different facility where you can get the records. So, but if all of your patients are ineligible and you've marked them ineligible, then you can still receive credit for 5.7 since you did the work to assess the eligibility. If you need to send us an email about what's the problem with submitting the patient, make sure that you include special study IDs so we know which patient you're talking about. So if you need to request a patient that has been deleted as not eligible, if you want that patient re-added on your list, just email us and we can put that patient back on your list, but just let us know which one you would like it to be replaced with so we don't replace it with one that you're already working on. So if the doctor's office will not provide the records, then you just need to mark the patient ineligible, and this does not count against you for 5.7. We are still counting those patients as meeting standard 5.7 if all of the patients are submitted as either eligible or ineligible. So right now we don't have a date set for the deadline to have a patient replaced. You can ask for a replacement patient up until the deadline of August 28th, but we would hope that you would have all of your patients before then in case you need to ask for outside records. We are not asking the registrars to interpret PSA results because there are different PSA definitions for different situations. So we ask that you please use the clinical notes to see if the physician thinks the patient has a recurrence. And if there's nothing in the notes and the patient starts treatment, then that is considered, then we want you to document that as a recurrence and so we can capture the treatment information. So there will not be a confirmation that you have met the standard. If you have no more cases to work on, then you are complete with the study. We will be posting the ratings for the standard after the study deadline. So we won't be posting anything while the study is still going on. We have always required for this study that the PCP should be sending you the records since the start of the study. So if you know that all of the PSAs were completed by the urologist and the PCP did not have any PSAs, then it does not need to be documented. If you're sure that the PCP checked no PSAs at all, then the patient is eligible and you can proceed. So if a patient is described in the clinical notes as having persistent disease, we are using the first PSA date after treatment as the recurrence date for consistent practice among the study participants, as opposed to the date of the clinical note. That is correct. So we ask that you would wait 2 weeks, and then if you haven't heard back from the outside facilities, then mark the patient ineligible. If you know that the patient, if the urologist practice is not providing records, then you may be able to mark patients of that particular urologist ineligible as they come up in the queue. The results for this whole study could take a while for data analysis and publication. So the 2015 studies are in this process right now, and we will notify you once we receive them. think we have 1 more minute for questions, and then we will be ending the webinar. So if nobody has any questions, we can be done for the day, but if you have any more that come up, just email us at specialstudy@fax.org. And thanks for all your hard work.
Thank you.